So, Mr. Speaker, and our side also conceded the main factor of this debate is patient, and patient should be prioritized. This is conceded to the government side. And however, and we believe that, and this motion is this motion gives a harm to patients. So we proudly oppose this motion. And before moving to my argument, I'd like to clarify our stance. And our stance is that and family and doctors sometimes should tell a lie for patients. And in our models, and doctors talk to his family and think about the possibility of recovery or patient's mental condition or think about such kind of an situation, and after that doctors and family decided not to tell the truth about the illness to the patient. So in our models, and if the situation changes, like patient and seems to be noticed about it, or the situation terribly worse or like that, and always and doctors and family talk to each other, and after that and change their way and telling that they can and tell the truth. So before moving to my argument, and I'd like to a lot of refute to the government side. The government side talked about three things. First is harm for a patient, and second is family's burden, and third is real desire. And first of all, I'd like to refute to the harm or the a relationship, the trust relationship between patient and doctors. And I have a three refutes. And first is that, and first of all, and in our models, and family and doctor talked, and the patients know that, and this decision is based on the consensus of family. So we believe that, and even if the doctor didn't tell the truth, and patients know and about it, the patient don't doubt or not the patient and there's very low possibility to not depend on the doctors or like that, because the doctor is one actor that can and help, and save our life, our patient's life. So even if the patient notice that, and the doctor then sometimes and telling a lie, this is not the reason, and patient don't go to a hospital or don't and concentrate their treatment, because the patient know that the importance of the doctor or their goal is treated themselves. And the second response is that we believe that this situation is very small possibility to tell a lie, and the patient understand the doctor's law, and we believe that doctor's law is not saying and always truth. We believe that the law of doctor is making people happiness or treating themselves. So the patient will many people and almost all citizens and realize this purpose, so we can understand and concentrate it on their treatment. And even if the such kind of deceptive people or doubtful people, family and doctor they can say truth in our paradigm. They can of course ensure not to tell a lie for the patient if the patient is such kind of deceptive people or like that. So this doesn't stand. And second, I like to refute to the family, and we believe that the family's desire is to live longer for the patient, becoming happy or like that. So even if less communication, the family does not feel its burden to help their loving family, and even if they feel bad or uncomfortable, they can decide to tell the truth after talking about the doctor. So it doesn't happen. And after that, I like to take on third refutation is that real desire, and we believe that the government I talked about last time or like that. However, even if there's small possibility to recover, and after that I tell you, and if this motion is not introduced and given the doctor and can tell a lie, this is there and have the possibility to recover for the patient. So we believe that even if that kind of even if they cannot enjoy the last time or lose their time, and we believe that we can and have possibility to we can give the chance to recover. So for this reason this is our station. And so I'd like to talk about our arguments first, and what happened after telling the truth, and the second, how we can change the terrible situation. And first, what happened after telling the truth. And if the patient knows truth, like they cannot get back to normal life no more because of cancer or like that, they can never expect it. So they are supplies or upset or they depression, they get depression, and in depression they cannot listen an explanation from doctors and carefully or clearly. So they concentrated on this or a bad end. So and feel all treatment are meaningless or like that. So easy to give up treatment, or worst case they committed a crime or such kind of terrible things happen. And however, if the doctor can tell the truth, in sometimes we can see the placebo effect or such kind of good effect for the patient. If patients believe, they will be well again and believe free, and they actively accept treatment or think about their health and seriously. So this gives the possibility to overcome the terrible disease or get back to the society. So we believe that and we believe that doctors see many cases and know how to treat is better. Because we go to the hospital, right? So we believe that sometimes telling the truth is become terrible or terrible terrible situation and happening. And if this motion is introduced, family and doctor can decide the best way for the patient. So for this reason, we strongly disagree with this motion. Thank you.